I thought I was going to die. Hi, my name is Yanni. Welcome back to another video. Today's going to be a real chill chit chat with me because I am working at the same time that I'm filming this video. Relax, no fireplace setting, just me at my desk typing away, telling you all my story. Just a little disclaimer, this story is very graphic and I'm going to be detailing things about blood. If your stomach is weak, I say you click off this video. Go watch my other videos. I have other videos on this channel and I'll see you in the next one. Started my period when I was 12 years old. I know a lot of people, they start either between like ages of 10, 13, like it's normal for us, right? But I noticed that my period was pretty heavy when I started. And I don't know if that was something that's normal for you, but at 12 years old, I was pretty heavy. It wasn't extremely heavy to the point where it was like, okay, let's be alarmed. But it was heavy to the point where I'm just like, okay, I guess this is just my normal flow, right? And at 12, you're starting your period, you don't really know anything about periods at that point. You're a child. I mean, you're expected to know, but you know what I mean? Like, you're a child. You don't really know about periods like that. Time goes on. As I get older, I notice that my period is getting heavier and heavier. Now, at this point, I wasn't diagnosed with fibroid tumors. Fibroid tumor, from my understanding, are supposed to be benign. They're not supposed to cause any issues or anything like that. And the fibroid tumors are located in the uterus. And I forgot the other name for fibroid tumor. If I can find my paperwork for it, I'll go ahead and upload the name for a fibroid tumor. But anyway, they're supposed to be benign. So at this time, I was not diagnosed with a fibroid tumor, but my period was aggressively getting heavier. I also was nauseous. I was throwing up. I had to miss school during my period because I was throwing up so much. I couldn't even sit up in a chair. I couldn't even hold a conversation. My cramps were so severe. Most of the time, I couldn't even get myself out of bed. Like, my period was that bad. For mom, she likes to approach things with more of a holistic approach, and I definitely understand that. And I approach a lot of things holistically as well, as far as like supplementing with vitamins and things like that. However, even though I wasn't diagnosed with a fibroid at that time, I feel like I might have had one just because of the severity of the symptoms. And I don't feel that a holistic approach was the greatest remedy for that time period. As time progressed, so in high school, I'm nauseous, I have severe bleeding, and my period was going from anywhere from 7 days to 10 days. And everywhere I read, it's not supposed to go that long, from my understanding. And this is everything I read like back in the day. I'm talking about back in the day. I was in high school in 2002 to 2006. So we're talking about during those times. And the articles that we had during those times is not the same articles we have today. We have more resources today. What I did was I started going to the doctor just in high school, letting my doctor know, like, hey, like, I have heavy periods, I'm experiencing nausea, I'm experiencing heavy bleeding. And they usually ask the normal questions about how often are you experiencing this, what are you doing. What was recommended to me was a few dietary changes, which I did do. I did do a few dietary changes. I started exercising and moving more, and it seemed to help a little bit. Like, my period started getting better as far as like heaviness. Like, instead of me going to 10 days, I was bleeding anywhere from 5 to 7 days. And then I noticed that my periods were a lot lighter when I started moving more and eating better. Now, fast forward to my mid to early 20s. What I noticed was that the symptoms like ramp up. So I would start getting nauseous before my period would come. I was throwing up and I was experiencing severe cramping. And what I mean severe, I mean to the point where it was like debilitating. Like, the cramps were just so bad to where the pain would start in my uterus and it would go all the way up my back to my neck. It almost felt like my uterus was just doing this, like this motion. And later on, the doctor that helped me with my situation said that I was having contractions, but at that time I did not know what that was. I noticed that my period was going from 7 days to 10 days to 20 days to 30 days. By this time, I'm like, okay, I need to go back to the doctor to see what's going on because my period should not be this long, right? So I go back to the doctor and I'm telling her all my symptoms. I'm telling her what I'm going through, the severity of it. I'm giving her the whole rundown. I come in with receipts because I was documenting everything heavily because I just wanted to make sure I gave the doctor the right amount of information, and I just didn't want to miss anything. And I wanted to make sure I was getting the proper help that I needed. This is beyond my primary care doctor's specialty. She refers me out to a gynecologist. I make an appointment with the gynecologist. By the time I get my appointment with the gynecologist, I was bleeding. I think at that time we are going on like 50 days of bleeding at this point. So by the time I got to him, I was extremely weak. I was tired. I could barely walk. I barely work. You can tell like my body was just slowly shutting down. And to be honest, I thought I was going to die. I don't know if you all ever had an experience to the point your body was so weak that you felt like it was going to give out and you felt like you just couldn't move forward and you felt like you were just giving up. That's where I was at this point. I felt like I was just going to collapse and die. And I was to the point where I was like, okay, well, if this is where my life ends at 26, then that's just where my life is going to end at 26. Man, thinking about that just makes me choke up. If you never felt it, feeling like you're gonna pass away, you don't know what I'm talking about, but it's just a scary feeling. That's the terms that I came to. So anyways, I'm at the gynecologist. Doctor I see, I did not feel right in my spirit about this man. I don't mind having men doctors. Honestly, I don't care what type of doctor you are. I don't care if you're black, white, Mexican, whatever. As long as you are a teacher and you can help me and you can educate me, I am for you. But on the flip side, my primary care doctor was, because she's no longer my primary care doctor, but she was a black woman. So of course, yeah, I related to her more. And of course, I felt like she had my best interest at heart. And don't get me wrong, there are some people of the same race who don't have your best interest at heart. But I feel like for me, with my primary care physician, I basically grew up with my primary care physician. She's known me since I was a kid. We also ended up going to the same church together. Not together, but you know, like I didn't know she went to my church until I saw her in passing. But anyways, this doctor was a white male, and I am the person who does not like pull the race card unless it's being used in a right context, because some people pull the race card and they use it as a victim mentality when they're not even being victimized. And that's a whole nother conversation. But I felt like this doctor was racist. I felt like he didn't have my best interests at heart. I felt like he didn't care about my needs. And it showed in the care that he provided. When I talked to him about my fibroid tumors and I'm telling him about all the symptoms that I'm having, do you know that this man was just like, well, fibroid tumors, you know, they're not that serious. They don't usually cause any issues. They're usually benign and non-cancerous. Basically dismissing what I just told him. I'm over here standing here weak as hell and you're dismissing everything that I'm telling you. Get this, my iron levels, my ferritin levels, they weren't even on the chart. My blood was so low that I could have probably died at any moment. And do you think this man cared? No. So he's telling me about all the treatment options. He says, you know, I can go on birth control. I never been on birth control. Didn't want to use birth control. Wasn't going to start in my mid-20s using birth control. So that option was a hard no to me. He explained about Lubron Depot, saying it's a shot. I can give you Lubron Depot. It will shrink the fibroids, but then the fibroid will double in size. My fibroid tumor at that time. Oh, and I forgot to mention, my primary doctor did diagnose me with fibroid tumor. She got the necessary tests to see what it was, and it came back as fibroid tumor. I forgot to mention that, and that's why she referred me to a gynecologist, because it was beyond her expertise. That's not her practice. And so that's why I was seeing a gynecologist, and that's when he started recommending different treatments. So now we are at the Lubron Depot, and he's explaining to me how even if I got the Lubron Depot, the fibroid would shrink and then it will blow up. So there was really no point in me getting the Depot shot, is exactly what he said. So he was just saying it's a temporary fix. So we go on to other options such as partial hysterectomy or hysterectomy. Now, I don't know about you all, but I have never heard of a doctor recommending, actually, let me rephrase that. As a 26-year-old woman at this time, do you think I want to get a partial hysterectomy or a hysterectomy at a childbearing age? I know not everybody wants to have children, but I wanted to have children. There was just no way that I was going to get a hysterectomy at 26. Yeah, there was no way I was going to get a hysterectomy at 26 years. I don't even get why that was even an option or even a discussion for a 26-year-old. Really? Honestly, I didn't like the man's attitude. I didn't like the fact that he was condescending at all. I didn't feel like he had my best interest at heart. So I ended up leaving that appointment just feeling more lost, and I felt like I didn't get the help that I needed. I felt like I wasn't listened to. valued. I feel like I wasn't cared about. I feel like I was just dismissed. I feel like he really just glazed over that I've been bleeding, I think at that point for like 50 something days or more at that point. So I go on and I start researching on how to take care of fibroids holistically. I start looking at vitamins, I start looking at other treatments, and a lot of things that I found was weight loss. And at this time I was teeter-tottering between 232 and 238 pounds, so a little bit under 240 from where my highest weight was. And during that time I just kept gaining weight because of the fibroid. I looked like I was 6 months pregnant. If I have any photos of that time when I actually had fibroid inside of me, I'll go ahead and put a photo up so you all can get an idea of what I was dealing with. Not only was I dealing with fibroids and weight gain, but I also wasn't eating the best. But a lot of my weight gain was in my stomach area, which allegedly, and I say allegedly because I've seen mixed articles on this, allegedly the fiber causes stomach weight gain, or it causes weight gain more so in your torso area. That's why I say allegedly, because not every article says that. But so after that appointment, I'm just going on about life, and I end up finding some vitamins that are supposed to help with fibroids. I ended up cleaning up my diet and exercising. I lost a little bit of weight, but then I kept gaining the weight back, lost a little bit of weight, gaining the weight back. I was just in this like yo-yo cycle. And my thing is that I was bleeding so heavy at this point to where I was bleeding through my clothes. I had to take at least like 5 to 7 pairs of underwear to work every day. I had to take multiple clothes to work every day. When I say I was bleeding heavy, that is an understatement, because by the time I was getting to this holistic approach and trying to start my fitness journey and all that, I believe I was about maybe 160 days in of bleeding, and I had blood clot this size coming out of me. Just let that sink in. This size. Yeah. So it seems like everything that I was doing as far as like my holistic approach, things were just progressively getting worse. So I ended up going to the ER, which if you have a fibroid tumor, I do not suggest that you go to the ER. Do not do it. They cannot help you. I'm so sorry. Like, they cannot help you unless you're going in there for like some type of blood transfusion or something like that. And I hate to tell people like, don't go to the ER. And I'm always saying that because I specifically had an ER doctor tell me, I'm so sorry, there's nothing that we can do for you here. For fibroid tumors, there's nothing we can do for you. I understand you're feeling weak, you're feeling tired, you're bleeding, but there's nothing that we can do for you here. I had to go back to see my primary care physician, who gave me some medical grade iron pills, because at this point they wanted to give me a blood transfusion, but I didn't want to get a blood transfusion just because it's only masking the problem. It's not necessarily fixing it if the fibroid is the one that's causing the bleeding. So if I'm getting a blood transfusion, you're putting blood into me and I'm severely bleeding out, and I'm already at the 160-day mark. A blood transfusion is not going to help me, honey. It's just not. So she gave me high medical grade iron pills. And if you all have ever tried high medical grade iron pills, those pills get your iron up within like a week or so. So after I took those pills for about a week, I had to go back in to make sure my iron levels were going back in the right direction, because remember I said my iron levels wasn't even on chart, but they wanted to make sure that I was going in the right direction so they would not lose me. I told my primary doctor about my experience with the gynecologist, and she was like, oh no, honey, you need to switch gynecologist. So I switched the gynecologist. I go back, and before I go back, I prayed about it, because I'm like, I need someone who's gonna be here for me, who's gonna be a teacher, I needed someone who was gonna listen to me and who was gonna take me seriously, and someone who knew that this was life or death for me. The quality of life for me was at stake. During this time, with me bleeding like that, I was avoiding people. I was avoiding going out. I was avoiding the gym. I would stay in the house because I was bleeding so heavy that I kept bleeding through my clothes. I had bled out during work, and people were just like looking at me like, what is going on? I was missing work. I was always late to work. And this time was just so stressful because not everybody knew that I was dealing with this, and just trying to stay afloat and then also hide the fact that I'm severely sick. It's weird, like being a young person and being extremely sick, and you don't look extremely sick, but you're just going through all this stuff. So basically I was trying to hide and make it seem like I had it all together, and I did not. I was literally dying on the inside, venting to my doctor about it. And thankfully I got a brand new gynecologist. And do you know, the gynecologist that I saw no longer works for the practice. I did not complain or anything like that. I don't know if he got let go or if he just left, but me being curious, I ended up looking at some reviews, and apparently none of the other patients liked him either. It's very condescending, same things I said, doesn't care about your needs, doesn't care about the patient. So yeah, he was not there when I went. But thankfully the doctor that I got was just, oh my God, he was such a sweet man. Just heaven sent. Like, there's just some people that you meet where I'm just like, how are you here living amongst us? How are you just this sweet? Like, I wish I could just package him up and just put his soul into other people. Because this man was just really God sent. And I still think about him to this day because that's just how great he was. So I tell him everything I've been going through, and he looked at my chart and he's like, oh, I thought you were here for this diagnosis. And do you know the other doctor misdiagnosed me with something else? And I cannot for the life of me think of what that diagnosis was, but it was a wrong diagnosis. Let that sink in. Being misdiagnosed can be life or death for some people. And I've seen this happen so many times when people are misdiagnosed and then they get the wrong treatment. Something happens to them where they're debilitated, or something happens to them where they no longer are on this earth. And I feel like when patients come in and they tell you what their symptoms are, you do all the necessary things that you can, figure it out so we don't have slip-ups like this. But I tell him what, back to my doctor, I tell him, his name is Dr. Smith. Tell Dr. Smith like what was going on, and he runs down all the treatment, right? But he wasn't condescending like the last doctor about the treatment option. But I also tell him what I wanted. And I told him, hysterectomy is not on the table for me. I'm only 26. I want to have children. And he's like, I wasn't even in my cards. I wasn't going to tell you that was an option for you. You're young. Why would I recommend a hysterectomy? He was like, now, if you were like 55, or if you were, 45 and all your kids were here and you didn't care about having more kids in a different stage of your life, I would have recommended a hysterectomy. But he's like, for you, that's not an option. And I was like, okay. And he didn't recommend a partial hysterectomy. He said, that's not an option either. And I was like, okay. He's like, I see you didn't try birth control. And I said, no. He said, I've gained so much weight already from the fibroid tumor and unhealthy eating. I do not want to gain more weight. So if you put me on birth control, I will walk out of this office. But on a serious note, I was so done at this point and I needed help. Oh, and by this time I was bleeding for 270 days. 270 days by the time I saw this man. He was like, okay, well, he's like, looking at the size of your tumor, he's like, it's as big as a tangerine. Like, it's like maybe this big inside of me. I don't know if you guys can see that. But yeah, so it was like this big inside of me, which is pretty big to be sitting in your uterus. Where it was blocking my tubes. He was saying, given how big it was, he recommended surgery. But the surgery that I had to get was basically like a C-section without a baby. Is the simplest way I can put it to get you to understand. However, it's more severe than a C-section. If that makes any sense. Like, they have to cut through so many layers to get to my fibroid. And once they got to my fibroid, they also had to cut it out of me. And that's how he explained it. And I asked him, could I have gotten it removed laparoscopy? And he said no, because of how big it was. They would have to cut me open and I would basically have a C-section scar. So they would have to cut me from my bikini line. So basically from one side of my hip to the other side of my hip. As scary as that surgery sounded, I opted to get that. And he felt like it was medically necessary for me to get that surgery as soon as possible because of the amount of blood I already lost. He said if I continue on like this with the amount of blood that I was losing, I would no longer be here. And it goes back to how I was feeling when I told you I felt like I was going to pass away. I never want you all to have that feeling. I mean, I know we all die. How we die, we're not going to know. But that feeling of feeling like you can no longer live because you feel your body is so weak and you feel like your body is just giving up is the most scariest feeling. And I'm so happy that I found Dr. Smith because he saw the severity of my situation and he was willing to help me, and he felt like it was medically necessary for me to get that right away. And I'm glad he listened because I felt like Lubron Debo was just a waste of my time, a waste of my money. Those shots are very expensive, only for your fibroid tumor to blow up. Birth control, I didn't like the option for birth control because of the weight gain and the hormonal aspect that came with it. But fast forward to the surgery. So the surgery, I opted for the surgery, and during this time, I was working in the office. I ended up putting in a medical necessity to work from home during this time. So this was 2016. So I felt like it was medically necessary for me to work from home, and my doctor felt like it was medically necessary for me to work at home as well. So just to run through, I got diagnosed with fibroids in 2014, right? And that's when I started seeing the doctors, and then I had that bad experience with that one doctor, and then I did not go back to the gynecologist, tried the holistic approach. 2015 and 2016 is when I was in and out of the ER. It almost kind of goes together because I feel like the severe bleeding really didn't happen until I want to say like mid 2015. No, I want to say early 2000. No, so end of 2015 until 2016, if that makes any sense. I know the timeline is kind of crazy. It's been a while. So, but I just know I was bleeding for 270 days. That's when I stopped counting. I know I bled longer than that, but that's when I stopped counting because it was getting to the point where I was just like, I just can't keep up. Anyways, my doctor felt like it was medically necessary for me to stay home because of the severity of my bleeding, the embarrassment, me calling off from work all the time, me always being nauseous in the bathroom, throwing up. It was just a lot going on during that time. So I ended up getting a medical necessity letter from my doctor to work from home, and I got it approved to work home. So I started working from home in 2016, and I mean, obviously you guys can see that I'm at home right now. 8 years later, I'm still here. But I also forgot to mention that the severe cramps that I was getting was contractions. I didn't even know that contractions was a thing for fibroid. And the only reason why I know that is because my doctor had to do a vaginal ultrasound. And that's what I forgot to mention too. I got a lot of vaginal ultrasounds, and then I got a lot of, forgot what the other ultrasound is called when I guess just a regular ultrasound when they do it on your stomach. So I got that, but they couldn't really see like the fibroid that well. So I had to get a vaginal ultrasound. If you've never gotten a vaginal ultrasound, it's basically, it looks like this little long wand, and it almost looks like I don't know what I can say on the internet. I don't want YouTube to flag me, but you read my lips, you know what I said. But it let's just say it looks like a wand, and it's about like this long, and they put it inside you, and they can basically see the tumor that way. And when the nurse was doing that, she was telling me that I was contracting, like I was having contraction. And she's just like, yeah, it's like your uterus is contracting. And I was just like, really? I was like, is that normal? And you know, of course, as a nurse, she didn't want to discuss that. So I asked my doctor, and he's like, well, what's going on is that your body thinks that the tumor is a foreign object, which it was a foreign object. Okay, it's not supposed to be there. But it was basically trying to like rid itself. But I was like, so it was ridding itself as a form of contracting as if I was giving birth. I don't know, I was just like, wow. So that explains the severe extreme pain. And I'm just saying this lightly, and when I say extreme pain, it was debilitating because the pain would literally shoot from my uterus all the way up my freaking spine, up my back to my neck, to the point it was causing me to have like chronic headaches. It was just so bad, so bad. I'm sorry, this video is extremely long. I don't even know how to make it shorter than this. I feel like I just need to get out the full story. The surgery. So how I got to the surgery. So they had to prepare me for the surgery. You all know that I was bleeding extremely heavy, and I was still on those medical grade iron pills. So I had to make sure that my iron levels were good for the surgery, because they weren't going to operate if I lost too much blood, because I wouldn't make it during surgery. So they had to do, of course, heart tests to make sure I'm good. They had blood transfusion. They had my blood on the side for a transfusion already ready to go before my surgery. They also tested my blood levels to make sure I was okay. So everything was tested before surgery, and everything was ready to go. The only thing I had to do was book my surgery, and I booked it, and it was like a week or so out. During this time, I was excited to get the surgery because I knew I was going to have relief finally. But at the same time, I was so scared because I've never gotten that type of surgery. The only surgery I had at this point, at this age, was getting my wisdom teeth removed. So for me, this was a big deal, and the recovery time postpartum was 8 weeks for this particular surgery. So I go in, the doctor gives me the rundown on what's going to happen, how he's going to cut me and where he's going to cut and how it's going to look, the healing process and all that. We also go over what happens in the event if I die, or if I am unable to speak, or or if I'm in a coma or anything like that. So I also had to sign that paperwork and just talk about my rights being the patient and do like power of attorney paperwork and all that. You never gotten surgery if you never had someone like that you had to take care of or anything, you wouldn't know what a power of attorney is or authorized representative that could act on your behalf. And so I had to do all that stuff. I go into surgery. The only thing I remember is me going in, talking to the doctor, giggling, laughing, and then boom, wake up and I'm in severe pain. So I woke up in a recovery room in extremely severe pain, and that's because the nurse that was supposed to be watching me didn't give me, I don't know if they gave me medication and the medication wore off, or they just forgot to give me medication. I don't know what happened, but I woke up screaming, y'all. I woke up screaming in that room, and the nurse is like, she's awake, and I was like, I'm in so much pain, and I was like, somebody like give me some medicine, like something. Oh my God, the pain after that surgery was just horrible. I don't wish that on my worst enemy. So I got medicine. My doctor comes in, he apologizes on behalf of the nurses. This man was so sweet, you guys. It wasn't his fault. The nurse was there. But he talks to me about recovery time, how I'm feeling. He talks to me about what medicines that are going to be in my IV. He talks about the medicines that I need to get after surgery. I think I was on Vicodin. I can't remember which exact medicine I was on. But yeah, he was just saying that I needed to rotate my medicine for a couple of weeks. I'm going to be sore for a while. And then he talks about recovery rate and just basically what I need to do to recover. No exercising, of course. Did need to move around so my blood can start flowing so I don't get inflamed. So I did need to walk around. But after that, honestly, it felt like someone cut me in half is how I explain it. It almost feels like my lower half of my body was just done. It was gone, which is such a weird feeling. I didn't even feel like this after my C-section. After my C-section, I actually felt better after a C-section than I did with the surgery. But I did bleed after the surgery because I got the surgery in January. I bled January of 2017 to be exact. And then I bled until March. I believe March was also my first period. So that was normal. The bleeding was normal. So March, my first period comes, and I am like having anxiety because I haven't processed yet that the tumor is gone and that I'm no longer going to be bleeding like that anymore. So I'm hyperventilating. I'm having anxiety about something that's not even happening. So my period comes and it's done in 5 days. I didn't have severe cramps. I had cramps, but they weren't severe. And I wasn't throwing up. I wasn't nauseous. To be honest, I didn't even know my period was coming. Didn't even know it was sneaking up on me, which is so crazy. Like, it's just like night and day. Like, my body felt normal. Like, it felt like, I don't know. I'm just smiling right now because just looking back at that time, it was just such a relief. And I would do it all over again if I had to. The surgery itself was very scary, but I would do it all over again. Just knowing what I know now, how I'm feeling now, not being nauseous, not having contractions during your period, not bleeding through your clothes, not having to skip out on parties, birthdays, avoid people, like all that, like going through that was just so worth it for me. Oh, and I know I keep forgetting things, but they did do a biopsy on the tumor, and of course not of course, because cancer just run in my family, but it came back benign, thank God. And I was so happy that they actually did a biopsy, because what I'm hearing is not a lot of people get a biopsy on their fibroid tumor, because fibroid tumors are not known to cause any issues. They're not known to, it's rare when they are cancerous. Like, I think everybody's tumor should be tested. Even though it's not known to be cancerous doesn't mean it can't be cancerous. Like, it can be. And then of course they were looking at my age, but I'm like, you guys got all these children hospitals and children cancer hospitals and cancer treatment hospitals, and you don't want to test people because of their age, because it's rare. Just because it's rare doesn't mean that they will never never get it. You know what I mean? That's above my expertise, but it's baffling to me. But yeah, so after the surgery, I quickly started discussing children. And because I knew I wanted to carry a child. I wanted to have a baby. I mean, you all know I have a son now, which is awesome. And that's another thing he did mention, even with the surgery. He's like, after the surgery, you can have kids. The only downside to having kids is that you have to have a C-section every time. You cannot contract, which is perfectly fine with me. I mean, if I have to have a C-section, I have to have a C-section. That's fine. And I would rather choose that than choosing to live every single day thinking I'm not going to make it another day because I'm bleeding severely heavy. But yes, I talked to him about having kids. He said I have to wait a full year before I can even think about carrying a baby. And then he said once that full year is up, then we can discuss it and we can send me to an infertility specialist to get my uterus checked out and run tests and make sure I am okay and my body is fit to, not fit as far as like physical, like, you know, not visually, but fit as far as to carry a baby. Make sure my uterus is okay to carry a baby. Because after a severe surgery like that, like it's a lot of wear and tear on your uterus. The surgery that I got is called the open myomectomy. And I'm sorry that this video is just everywhere. As I'm speaking, as I'm talking, the information is just popping up. And also I got the surgery 7 years ago, so it's been a while. But yeah, I got the open myomectomy, which is, if you look it up, I don't advise you look it up, but if you look it up, that surgery is just a lot of wear and tear on your vagina. So, but yeah, that is my fibroid story, and I'm happy that I got the outcome that I got, and I'm happy that I was able to find a doctor who actually listened to me and who fought for me, and I got exactly what I wanted. Because I hear so many of you women, especially minorities, they get fibroid tumors that are severe, that is actually causing them their quality of life, and they don't get the help that they need. Most doctors don't know what to do. And a lot of you all have opted for a hysterectomy. I met someone my age who got a hysterectomy because her doctor said that was the only option that she had. And it broke my heart because she wanted kids. I mean, you can adopt kids, yes. But at the same time, like, she wanted to make her own kids specifically. And it's heartbreaking that a doctor would recommend a hysterectomy first versus all other treatments and other routes. And it makes me so sad. And I wanted to remake this video for you all because hopefully this can help someone out there hearing my story, because a fibroid tumor is more common than a lot of people realize. I met so many people with fibroid and who were literally suffering in silence. And I have been seeing a lot more fibroid tumor treatment as of lately. So I'm assuming the treatments may be better, the medicines may be better. I mean, I wouldn't know. My tumor hasn't came back, and I'm praying it never comes back. I haven't had the symptoms since my tumor was removed. I've been in great health. My period has been great. So I would not know any of the new treatments that are on the market right now for you all. But I wanted to end this video with this. I hope you all are having a great day, a great month. It's April right now, and it's beautiful outside in California. If you like this video, make sure that you give this video a thumbs up. Also, if you're new here, I do make videos about my weight loss journey. I lost 80 pounds, so make sure you check out my 80-pound weight loss journey first. And then I will have other videos like lifestyle content. And basically on this channel, we are getting our lives together, okay? I'm realizing that this channel is slowly turning into just health and weight loss and a little bit of lifestyle. So if you like that, make sure you subscribe.